Well, good afternoon, Chicago. I'm Jeffrey Jones, Universal Family Connection.
Good afternoon, Chicago. My name is Lade Odemosu from Universal Family Connection.
Today we'll be discussing World AIDS Day Chicago, and we'll be talking about prevention and HIV. We come to you monthly, the first Wednesday of every month, to talk about HIV in the Chicago area, along with other important information about social services in Chicago. Our agency, Universal Family Connection, has been around since 1976. Our CEO is Dr. Lorraine Broyles. This year's Universal Family Connection partnership with Nephews Case Management invites the community to gather on Monday, December 1st, from 10 a.m. to 2 for a day of education and remembrance, healing, and empowerment. That's going to be our annual HIV event.
We thank you so much for joining us today for this for our monthly TV series, and just to elaborate on our World AIDS Day coming up, as my co-worker has just said. Today we are going to take a compassionate look at HIV and AIDS in Chicago right now. We're going to talk about treatment and prevention. Also, we're going to highlight resources available to you and your loved ones. As we have been addressing, we are on the south side of Chicago, Beverly Hills area, and we, as being validated, it's going to be 50 years next year. We have so many programs in the agency, our department being one of them. We are spreading the word, we are testing, we go to different locations to test, and but the highlight of this show today is us addressing the upcoming World AIDS Day.
Okay. So today, here in Chicago, over 21,000 people are living with HIV. Let me say that again. Today in Chicago, over 21,000 people are living with HIV. That number is held steady in recent years thanks to advancement in treatment and testing. So it hasn't rose. As a matter of fact, it's decreasing somewhat, and so we're grateful for that. Mm-hmm. That's still a high number, and that's due to the fact that we're out doing education, and we're out doing our testing, and we're doing those things that are giving people hope, letting them know that HIV is no longer a death sentence, yes, but it is just a chronic illness that you can manage to live with.
However, the story is different according to neighborhood. Black and brown communities, particularly on the south and west side of Chicago, continue to experience the highest rates of new diagnosis and late diagnosis as well. And this is exactly why we are trying to reach out. If you need testing in your community, just reach out to us at 773-881-1711. We have testing mobile units. We will be there in a jiffy.
And that's something that we pride ourselves on. We purchased a a mobile testing vehicle last year so that people who have barriers to getting to us or getting to a clinic, the clinic can come to you now. So we are driving all over the south side of Chicago, or if you're having events in Chicago and you need someone to come out and testing, just give us a call, 773-881-1711. That's again 773-881-1711. Or you can visit us at the web and get more information. Call us up and we'll come out. You know, late diagnosis means a person who learns their HIV status after the virus has already weakened their immune system. So if you don't get tested, and many people don't know that they are positive, the HIV can turn to AIDS. Sometimes at the point of, that's where they finally find out that they're HIV positive, because now they're having symptoms. That's not about personal failure. It's about access, trust, and stigma. Let me say it again. It's not about personal failure, because people can, we have so much stigma going on. There's mistrust of the medical industry, especially by African Americans. And there's the stigma, the shame that comes along with maybe finding out that you're positive. And the access. Everybody can't get to a clinic. Everybody don't know how to access services. And so that's why we are around in our mobile van testing.
And just to let you guys know, stigma remains one of the greatest barriers to care, simply because people feel like they will be judged if they avoid treatment because of that, because the fear of, oh, I know somebody, or they know about my issues, they know I'm HIV positive. Please erase that, because getting care is very important. A stitch in time saves nine, as they say. The earlier, some people are undetectable. If you go through treatment as you should, you will get to that level with low viral load. So we are imploring you to reach out to us like we've been preaching, and don't be judged. We know it's hard.
Exactly. Don't allow the stigma or the shame, and that's easy for us to say, but you cannot allow the stigma and the shame to hold you back from finding about your status, because as soon as you find out, there's freedom in knowing your status, and now knowing that there's treatment available for HIV, and we have all kind of medications now, and so it's just like a chronic illness that is managed now. You take one pill a day, or one shot now that they're giving you, one injection shot, and you can only take that once a month. So there's many avenues to help treat HIV, but you have to come in and get tested first. But the truth is this too. HIV is a medical condition, and treatment today works. It works. We have clients that we see every week. On Friday, we have a psychosocial support group located at our location at 1350 West 103rd Street in Beverly. And they're living great lives. You wouldn't know that they were positive. Some of them have been positive for over 30 years. So HIV is a disease that you can live with.
Yeah, and that's exactly why when people go through treatment, like I said before, some people are undetectable, which means they can't transmit the virus. U equals U, undetectable, untransmittable, So the treatment is really working, like my Mr. Jones explained. There's so many different forms now. There's so much research going on it never stops to improve. Yes.
Exactly. Tell us about this U equals U real quick.
It's undetectable means untransmittable.
Mm-hmm.
Meaning if you take the treatment seriously, if you are using your medication, your viral load will drop. And sometimes it can be undetectable. So if a viral load is low, they can't transmit it to another person.
Even without a condom.
Yeah, even without wearing a condom. Yes.
Okay. Yeah. That's good to know. So you can still have relationships with your partner or your significant other if you are getting treated and your virus goes undetectable. And when the virus is undetectable, it's untransmittable, as Lade said. That message, U equals U, undetectable equals untransmittable, has been confirmed by scientists worldwide.
Yes, and people living with HIV who reach out and maintain this viral load does not transmit, like I said. I've said it ahead of time, actually.
Right.
So it is very, very important to get tested, know your status. If anything, even if you are positive, there's so many treatment options. It's not a death sentence. You can get treated and be undetectable.
Yes.
Basically.
And you know, this reality is changing relationships, families, dating, marriage, pregnancy. Most importantly, it is reducing fear. So knowing that undetectable means untransmittable is changing everything. It's a game changer.
Why are we talking about this? It's because World AIDS Day is coming up, December 1st, and we're going to talk more about it that day, because that's why the event is taking place, awareness all over the world, you know. And so we are having an event in regards to this at Universal Family Connection.
And we'll talk a little bit more about that
just
before we complete our segment today. Let's talk about prevention for a minute, Lade.
Okay.
PrEP or what's known as pre-exposure prophylaxis is a medication taken before a possible exposure to prevent HIV infection. It's called PrEP. Tell us more about PrEP.
Yeah, PrEP, when taken accordingly as prescribed, it knocks out 99% of the virus. I mean, it prevents, you know, whoever is PrEP, if you are taking PrEP, let's say there are a couple, one is positive and one is negative. The negative person can take PrEP so that the virus won't be transmitted to them.
Okay.
It depends on the viral load, as we previously spoke about. Let's say the person is still detectable, it cannot affect the other party because they are taking PrEP.
Okay.
So it's like a birth control in a way to prevent HIV.
Okay. Okay. And how is PrEP? How do you get PrEP?
It's available at like a pill or injection. It depends on the medical provider for that individual, and it's also available at emergency rooms. They will direct individual to the proper department or board of health.
Okay.
Yes. So those are the places.
Okay.
Yes.
There's also a PEP. It's called post-exposure prophylaxis, which is used after a potential exposure, but must be started within 72 hours. So you must get there right after you find out that you might have been exposed to it. Within 72 hours, you can take PEP, and it'll stop you up to 99% effective of getting HIV or contracting HIV and AIDS.
Yeah, and also for people that use injectable drugs, When you know this happens, PrEP can also help. Or if it was unprotected sex as well, they can go to the emergency for PrEP, and they have to take it for a whole, I think about 10 days, if I'm not mistaken, and it will really work.
Okay.
Before the infection is able to reach to germinate in the blood system.
Okay.
So, or anyone that overdose and all that, yeah, PrEP can help without judgment.
Yeah, exactly. And you know, prevention today is education, medication, compassion, and support. No shame, no fear, just access and care.
Yes, so true. That's why prevention is better than cure, as they say. You know,
An ounce of
because
prevention.
it's really better because when you prevent yourself, you are saving yourself a lot of headache, a lot of, you know, on bad happenings, mishappenings, you know. So it's advisable, everything we've been talking about, that we are pleading to the audience to place. Even if you are not on the south side of Chicago, you can easily go to any clinic, emergency room, anywhere that's medical services provided. You can ask to be tested and take it from there. But we are at your service to provide this service for you.
Okay. Let's talk about the World AIDS Day, Lade.
Universal Family Connection is having a great event upcoming on December 1st, 2025, at 1350 West 103rd Street, Chicago, 60643. We are partnering with Nephews Management Service. It's going to be great. We are inviting, if you are in the neighborhood or if you wish to come and participate, it's going to be a great event. We have a lot of guest speakers, food, fun, breakfast.
Right. The event is going to include educational presentations.
Okay.
We're going to have a great speaker. Healing and remembrance activities. So we're going to be placing the names of loved ones on the wall that have passed. Those who we have our co-worker Mary Turpin that we're honoring. Prevention resources. We'll have some prevention resources available.
Yes.
You can learn how to learn more about PrEP, and we'll have vendors in the building with us. Case management and referral services will be available as well, and space to honor those we've lost and those living and thriving, and those continuing the work. That's all of the stuff that's going to be included in this year's World AIDS Day event. It's going to take place December 1st at our location in Beverly. That's 1350 West 103rd Street. We'll have all kind of prizes and gifts and contests for the month of November. So please check our website and find out what we'll be doing.
And also, like my coworker said, there will be a lot of information. We will have vendors that will set up their tables to provide information to people. It's going to be great. Music, fun, and we will have special guest speakers at the event too. UFC, Universal Family Connection, has been on this serving Chicago families for almost 50 years. It's going to be 50 years in 2026. I think that's a big milestone, you know.
It is.
And all this time, we've been focusing on community. We've been providing support, trauma-informed care, and empowerment, meaning we have so many programs that covers all these areas. Talk about youth program, different youth programs, trauma program,
Domestic violence programs, substance abuse programs,
yes,
partner intervention programs. We have a great foster care program, adoption agency. If you are intact, a home of relative. So go to our website. You can see all of our programs. That's Universal Family Connections Chicago.org. Universal Family Connections Chicago.org. Nephew's Case Management brings specialized expertise connecting individuals to housing support, medical care, behavioral health, and long-term wellness planning. Nephews is one of our partners. It was started by Gina Lamar Evans. She talks about sex and really does a great job. So Nephew's Case Management, they bring specialized expertise as well, and they'll be in the building. They're one of our co-sponsors for this year's National World HIV/AIDS Day.
And for Nephews, together with Universal, we are creating a safe and welcoming space in providing the kind of service that we do to members, community, families, providers, and allies all over south side of Chicago. And we are so proud and happy to bring all this to your awareness. Like we said, we have addressed everything about HIV and how to prevent it, and if it's already exists, how to get into care and treatment, and also about our World AIDS Day coming up December 1st.
Okay, so here's what you can do today. Know your status. Get tested. We're at 1350 West 103rd Street. Just walk down there. You don't have to have an appointment. Just walk in and we'll do your test. You'll be done in and out in 20 minutes. You'll know your status. Ask about PrEP or PEP while you're there. When you come back negative, you can get on PEP or PrEP. If you're living with HIV, stay in care and aim for your undetectable. And then if you're not HIV positive, show some compassion to someone who is. Stigma has no place here. Yeah. We're trying to eradicate stigma for good.
So this is taking place this December 1st. It's a Monday event, and it's going to be great at Universal Family Connection from 10 a.m. to 2 p.m. In conjunction with Nephew's Case Management. Come and learn, show some love, and you know, they're gonna hang ribbons. You can do that for your loved ones too. We don't have to know the name, just we have ribbons. You can write the name and put it on the wall. All that is gonna happen. There'll be candles lighted for the...
Yes, we'll have a candlelight ceremony as well. So we're going to have a great event. Come on down. I'm going to have an awesome lunch. So have a lunch with us and learn more about HIV. We remember, we honor, we protect, and we continue to do the work to keep our community safe.
Yes. Oh, yes.